All right, talking about a last-minute rush, very late last night, the Health Department gazetted new regulations as an interim measure to control the spread of COVID-19. They are effective today. At the same time, the department has extended the public consultation period for its proposed longer-term regulations, which are more extensive. The new closing date is the 5th of July. For now, indoor mask wearing remains. The regulations also limit gatherings to 1,000 indoors, 2,000 outdoors, unless attendants at an event produce a vaccine certificate or a negative test. Then the venue may be expanded up to 50% of capacity. To discuss for a business view, we're joined by Business Unity South Africa President Bonang Mohale. Bonang, thank you for being with us. As always, it seems like we're effectively staying on level one with some of the more controversial measures like the minister enforcing vaccinations or quarantines are on hold while that public consultation continues. What do you think of these interim measures?
So, Francis, thank you very much for having me. I must apologize. There's load shedding where I am at the moment, and I'm hoping that you can still hear me.
I can hear you
first,
perfectly.
I think we welcome, we welcome the midnight retirement of the Disaster Management Act as part of the national state of disaster. When that happened, of course, it was on day 750, which is more than 2 years that we have been under national lockdown. The job of us as leaders is to increase clarity. It didn't help that two spokespersons from the Department of Health said two things that were diametrically opposed around wearing of masks by school children indoors. Before I came here, thank God, the Department of Health, Minister Ntate Joe Phaahla has gone on to really clarify that. And I think now we know that children at school indoors, like everybody else, need to wear their masks. There is a little bit of a loophole to say for those parents that are coming to watch their children play sport, if it's outside, they don't need to provide proof of vaccination or a negative PCR test.
Yeah.
I think it's an opportunity for two reasons, Francis. One, because one of the things that we need to do as a country is to complete our vaccine rollout, especially addressing two things. This issue of hesitancy and some of the vaccines that are now...
Bonang, we're losing you a little bit. We're losing the connection. Maybe you can move around a little bit if you can. And before you get to the vaccines, can we stick with the mask wearing? AfriForum, Solidarity say they're still taking court action. Some analysts have called them noisy groups. Would you say there's general acceptance around limited gatherings, around mask wearing, these sort of low-level restrictions? What's the feeling of business?
You see, at level one, when you are confronted with HSSE and a pandemic that looks like COVID-19, you want to comply, you want to intervene, you want to respect your neighbors. So we support it as business because, you see, this is where this notion of purpose for greater good comes in. Wearing of masks is necessary to protect our key relationships and our significant others. If you love your grandparents and your children, you'll wear masks, especially when you're indoors and you do go to public gatherings like sporting events that are held indoors. So we totally support. Yeah. The issue of expiry vaccines themselves, I think this is the time, Francis, where we need to be redoubling our efforts, not closing some testing stations and vaccination stations, and then others closing at 1,500 hours during the week. This is the time we should be opening 24/7, 7 days a week. Francis,
yeah.
back to you.
Well, this is a great business problem because I've heard pharmacies don't want vaccines because they're sitting there, they're expiring, so it's a burden to them. And we're seeing a lot of these stations, vaccination stations, close when, like you say, millions and millions of injections are set to expire in June, July and August. So what do businesses do if the demand is just not there? What do these centres do?
I think all of us as a country have now removed our foot off the accelerator pedal. Some people even believe that the Omicron variant is already behind us, and yet we are just entering the fifth wave. I genuinely believe that there are three buckets of people. The first is anti-vaxxers who can't do anything about those people. Then there's another group of people that just need more information so we could reach those people. And then there's a bigger group, almost 80% in the middle. They want to get vaccinated. They just don't have access. Because if they're going to spend 50 rand from Emondlo, Nkandla, Nqumtu to go to a vaccination site, they're not going to spend it. Because to them, it's a dance between a loaf of brown bread and a pint of milk. They would rather spend it on a loaf of brown bread and pint of milk rather than use that money to go and get vaccinated. I think we need to do much more to make sure that we take mobile vaccination units to where people are. Because we have always known that more than 46% of South Africans not only live below the poverty datum line, but they are actually on social security. When you add the 31%, which is 17 million people who are on social grants, and then you add slightly more than 10 million who are receiving the 350 special relief of distress grants. Francis?
Yeah, I mean, you're right to point out the economics, even though the vaccinations themselves are free. Bonang, finally, are you beyond disappointed that Aspen is also talking about closing its production lines that have been making Johnson & Johnson vaccines, and were even set to make a Spinovac, so that would have been licensed, and the IP comes from Johnson & Johnson, but it would have been an African-made COVID-19 vaccine?
We only have ourselves to blame because the president set us an immunity target, herd immunity target of 67%. This is 40 million people on January when this was set. We knew that the run rate was supposed to be 100,000 a day, every day. Had we done that, it would have taken us 400 days or 13.3 months, which means we're only going to finish now. When the Disaster Management Act was stood down, we're only at 30.3%. Less than half of what we wanted. So instead of doubling up, I think, again, we are absolutely in our quest to defeat and root out this pandemic. One, of course, is save lives. The second piece is about save livelihoods, because we knew that 10 times would be killed by hunger and starvation than those killed by the virus itself. Lastly, we wanted to break the link, and the only way you can do that is to be doubly vaccinated and boosters if you have to, just to make sure that in the event that you do get it, it presents as a mild influenza symptoms. Francis?
Thank you so much. Pity we're not hearing you very well at the end there, but we got the gist. Thank you for chatting to us tonight. Bonang Mohale, President of Business Unity South Africa.